I'm Katalin Hideghéty, a radiation oncologist and clinical oncologist working at the University of Szeged. And the whole morning will be devoted to demonstration how the lasers are incorporated and other type of optical techniques are incorporated into the fight against cancer. I have a little bit different background than the physicist, and I think that in the next decades, the most important will be to establish an interdisciplinary common word, because I think that sometimes it will be boring for engineers or physicists what I am telling. Let me know if something is not understandable. I try to explain immediately. And sometimes I maybe make mistakes explaining some physics processes, but the major thing is that we have to establish somehow a common language, and we have to learn the activity area of each other in order to be able to work together on an interdisciplinary base to fight against cancer, which is the topic for today morning. The importance of this fight is emphasized or underlined by the fact that the growing incidence of cancer disease or any type of malignant disease, and 15 million new cancer diagnosed yearly worldwide, and 9 million tumor deaths occurs. It's a huge number, but we can think about on another way. Yesterday, for example, I have seen a 6-year-old, we have seen together a 6-year-old boy who is struggling against his cancer, which is a locally growing brain tumor since 4 years. So if I see such like a small boy and young guy who has a cancer, we have to really put together all of our efforts to be more effective. What are the area of fight against cancer? First of all, we try to prevent the cancer development with having better knowledge on the different factors which may cause cancer, to decrease the smoking habits, and so on and so on. And it is actually quite good going on, especially in the US, if I think the smoking cessation. But as important to screen the different populations for precancerous lesions or very early cancer types, which can be eliminated at the beginning successfully. So these patients can be cured completely, and even with different screening methods, we can prevent the development, the malignant transformation of benign lesions, which we know that with high probability will be transformed to malignant cancer. And there are a lot of areas of use of lasers in different therapy methods. For example, laser surgery is well known. The PDT, the photodynamic therapy, is since 5-6 decades used already. And the advanced laser technique is coming more and more into the combined measures. Both diagnostic and therapeutical methods can be used in the same time. For example, the autofluorescence can be used to detect the lesion and laser technique to eliminate it. And there is a huge area which I shall speak about mainly today, the radiation and the nuclear medicine. There are two large disciplines which are dealing with that. The diagnostic part is represented by the nuclear medicine, mainly with PET-CT, we will speak about later. And for that, there is a huge need of isotopes, but actually it seems to be that in the next years there will be not enough isotope production. So maybe the laser technique will promote to that. And the ionizing radiation is really a huge discipline which is used against it is one pillar actually in the methods of cancer, malignant diseases, near to surgery and chemotherapy. And ionizing radiation can be combined as well as with different agents. So we will speak a lot about that because the new powerful laser technique allows to generate, to accelerate different ionizing radiation types with a laser-based technique. And there are some interesting little area of use of different lasers. Even soft lasers can be used for side effect management in the cancer care, and there are some potential future applications which we will speak about. The structure of the lectures is so that I try to give you an overview in this first lecture about the application of lasers which are presently available in the clinical oncology and in cancer management. Thereafter, there will be a longer part about the history and use of ionizing radiation. Thereafter, the third lecture will be given by Bettina Ugi. She is a biologist and she will eliminate the basics of molecular processes caused by ionizing radiation and the potential modification of its effect. And finally, I try to give you again a summary and overview on the present available laser-based ionizing radiation and physics and radiobiology research with that. So, coming back to the lasers in general and actually available application for cancer, not therapy, but this first one is the screening. And I show you I show you one example of gastrointestinal cancer screening, but all of the luminal organs, urological organs, gynecological organs, and what else? Do you have some? Yes. Which organ can be examined with an endoscope? Gastrointestinal tract? Airway tract, exactly. The lung, bronchial space, so the airways, the gastrointestinal tract, the whole, and the urological spaces and gynecological spaces. So almost the whole body can be examined. And the recent techniques, the confocal laser endomicroscopy, allow really the histopathological definition, histopathological detection of the different lesions. I have to say that it is only on surface detection. But consider, do you know how long is the gastrointestinal tract, for example? Only the colon, more than 1 meter. So if I would like to make a magnification of more than 1,000, it would take days and days of examination to examine all of the little part of the colon. So it is combined with staining, with special dyes, or autofluorescence, where the lesions which are different from the normal mucosa, because we can only examine the mucosa, the surface of the different organs, the lumen of the different organs. Then these lesions can be visualized and detected in more details. Go more and more, or larger and larger magnification can be used. If I go from up to down, then first is the esophagus, which can be examined, and the Barrett esophagus, which means that the type of mucosa, the cylindric cells, can be found instead of squamous cells in the cells of the stomach, can be found in the esophageal part, and from that lesion, cancer is very frequently occurring, developing. So if we can detect it in an early stage, we can follow it, or we can remove if it is small, and we can prevent the development of the cancer. So we can decrease the mortality by decreasing the incidence of cancer development. And we can detect such like dysplastic disorders in the whole gastrointestinal tract, in the stomach. And there is a very famous study, the so-called Japanese study. In the 60s, in Japan, the stomach cancer incidence was the highest in the whole world. They have introduced the screening, the endoscopic and camera-based screening, and it has decreased to one-third of the occurrence of the stomach cancer. And later on, after 10 years, it turned out that the mortality has been, as well as the death caused by stomach cancer, has as well as decreased with such like degree. So there is much more sense to prevent than to fight for each large cancer, against each large cancer. And the small intestine cannot be well examined by endoscope, but from the other way around, the colonoscopy is used to detect adenomas, and there are suspicious adenomas which are represented by the surface pits, which are very probable to transform to malignant cancer, colon cancer or rectal cancer. And actually it has been, unfortunately not in Hungary, but in other countries already introduced the colonoscopy as a standard screening method, performed population-based screening method for preventing the colon cancer development, and only in each 10 years should be the patient examined. So the responsibility of the examiner is quite huge, because if he does not detect this one single lesion, then he has the chance only after 10 years, and during these 10 years a cancer may be developed. So the methods which increase the accuracy of detection and helps for the doctors to see more has very high importance. There are a lot of methods for visualization, so improvement in visualization of surface pits. The use of autofluorescence is increased, the narrow band imaging, which helps to better with two cameras and two emitted light detection, and analyzation, informatic analyzation, computer analyzation helps to better visualize the surface pits. I shall show some images. And the light-induced fluorescence endoscopy and further very advanced methods may help to detect 1 meter long or even longer mucosa examination, and to detect different lesions which differ from the normal structures. For example, here you can see that the magnification and the different dyeing together with magnification can have much better. I think that it is better. I shall open it, so don't be afraid.
Maybe it would be better if you would shut down the sounds.
Yeah.
Okay, yes.
And then I can leave you some air.
Yeah. Thank you so much.
So now you can really see that the surface pits are very important and can help us to differentiate. The normal structure looks like this, and this is, for example, the asteroid pit, but we can be calmed because it will not transform to malignant lesions. This is a hyperplasic polyp or different benign adenomas, which shows like this. And different neoplasmas can be occur like this. This is a adenoma which may be transformed, and this is already a small round pit, which is already a flat adenoma, a cancer, a malignant cancer. And it has high importance how deeply we can go with our detection. because we were actually on the very, very surface. We have seen the surface bits. And nowadays, using the infrared light, we can go deeper. The optical coherence tomography as well as higher depth detection possibility, but of course for real staging of the patient, if we would like to examine all three walls, the part of the wall of the intestine, we have to use the ultrasound examination, which gives us a complete picture on that. But you can see that for screening, these methods are enough. The high-resolution endoscopy, the zooming of it, combination with different dyings, the chromoendoscopy, narrowband imaging, these all help us to detect more accurately the different lesions which are suspicious and which can be as well as removed by endoscopic intervention. I can share some examples on that. And the confocal laser microscopy, the optical coherent tomography, and endocystoscope, these all have the evaluation, real-time evaluation of the different lesions on a cellular level. Of course, for that, the doctors have to learn a lot. I tell you something about that. So this is the normal structure, but you can see that there are some different macules on that, different strange surface, but if we look closer and with higher magnification, it turns out that this is absolutely normal. But, for example, a very small, this is again important that a small lesion should be detected, as well as a small gastric tumor can be well detected by indigo chimerin staining and endoscopic detection. This is a colon adenoma, which is not very suspicious for tumor, and you can see the difference of imaging, which is the standard light endoscopy, and this is combined with the chromoendoscopy combined with staining with acetate or indigo chimerin and the narrowband imaging. You can see that it gives us the most detailed information on the surface of these lesions. And you know the setup of the devices, the light source, the fiber optic guided light to the mucosa, and the emitted light is detected. There are a lot of possibility for different cross-processing of these images, which help us as well as in the analyzation, and of course the whole examination can be archived or loaded into a video, so it can be seen, it can be evaluated not only real time but afterwards with inclusion of more experts, and it can be stored for a longer time. And if there is an excitation light which is used in addition to, then the autofluorescence, the emission of photons with the other wavelength can be detected, as well as it can give us a better visualization. And if the different coloring and special post-processing is used, then the reconstructed image contains much more details than the original was. The confocal laser microscopy looks like this, and you can see here the real histopathological staining. This is the real histopathology, and this is the confocal image. The problem is that actually the doctors are not trained for that. So the different disciplines in the medical activity are well separated. The pathologists are dedicated for examine the histopathology, and the endoscopic experts only to the surface pits and surface detection like this, but they have to learn that, or a pathologist should be included or should be standing during the examination. So in summary, the endoscopy and the development of different visualization methods of endoscopy can help us to detect the precancerous lesions, to detect early cancers, and it allows immediately therapeutic interventions. The tumor can be removed by the endoscope with the mucosal resection or submucosal dissection, and it gives us as high accuracy as a real surgery, and it can be done during some 10 minutes instead of an open operation and resection of the questionable part of the bowel. And we have to keep in mind that there are palliative measures which can be performed as well as with this optic system. Evaporation can be done if the lumen is closed because of the tumor, the occlusion occurs, then the evaporating laser source can be introduced via this fiber optic system, and it can be evaporated of a level that the lumen will be opened again, and the openness of this lumen can be maintained by putting a stand into it. And for example, if the patient has an esophageal cancer, he cannot swallow, he cannot eat, he or she cannot eat, and this palliative measures helps her to maintain the normal nutrition weight. And it is the same for colorectal cancer. If the lumen can be maintained, then there will be no life-threatening ileus occurring of these patients. The other large application area of different light and laser sources is the photodynamic therapy or photochemotherapy, which is based on three components. We need for the light itself a light-sensitive agent and a tissue which contains oxygen. Every tissue contains oxygen, otherwise in the human or in the living beings, otherwise they would not live. And I think that you know very well the method of that. So the photosensitizer compound is exposed to a light with a wavelength which is at the absorption maximum of the sensitizers. It will be absorbed, and with the get into excited status, and on one hand the autofluorescence will occur, and on the other hand the special intensity cause oxygen species, reactive oxygen species generation, because normally not a singlet oxygen is existing, a triplet oxygen is existing in the human beings, and in that case the type 1 means that type 1 means that from lipids and from different water molecules, free oxygen radicals are released, and the type 2, that singlet oxygen, which is as well as high active, is released, and it can be used as well as for each type of tumor which are existing on the air. I have, of course, but what is the background of these tumors? On the surface. It is very important that it should be on the surface. It is not this PDT technique is not possible to use, for example, in extremity soft tissue sarcoma, which is deeply seated within the muscles. It can be used only in organs where the surface is available for light, and it can be used for that, because of that, only for superficial tumors. Therefore, it is not very well spread but I think that there are much more application area which is actually used. All of the skin tumors, in the majority of the cases it is used for skin tumors, can be treated with this method, but all of the tumors which are occurring in organs where an endoscope can be introduced. And nowadays, there are a lot of endoscopes which can be introduced even into the brain or into the abdominal space, for example, so, or in mediastinum, where it was not possible previously. Why it is selective? Because the agents which were developed, photosensitizing agents, were developed so that they are taken up selectively by the tumor cells because of lot of reasons, because of the huge proliferation, because of the different metabolism. The first type of these agents were porphyrins, which were used, but there are second generation agents as well as. And if this photosensitizing agent has a much higher concentration in the tumor, of course, if it is collected in the cancer, it is irradiated with light, then it will be separately destroyed by the free radicals which are occurring only locally in the tumor, which has a high photosensitizer uptake, and it can be absolutely eliminated. This is the physical basis of the excitation, absorption, and release of photons, which can be due to the electron changes from one orbit to another around the nucleus. And this is the electron passing of free radical building from water on from oxygen molecules, and the application area, which is much more frequent in skin cancers, in the dermatology, but it can be used as well as, this is a glottic cancer, which will be completely eliminated by this BDT technique. And I think that it could be used for much more cancer. 5 years ago, there was a great enthusiasm from the part of the neurologists to buy this system, but finally it has failed, this project, unfortunately. And at that time we have went through the literature, and it turned out that there are special countries and special groups who are using, they are very enthusiastic, they're producing a lot of publications, so there are clinical evidence of the benefit for that technique, but unfortunately it has not spread as it should be. And it is, for example, PDT therapy of a bronchial part, a bronchial tumor, prior to the therapy, during the therapy, and thereafter, after 2 years, the patient is tumor-free. So what else can be done with lasers? The surgery, which was introduced by head and neck surgeons. It is a Hungarian-originated but he was working in the US when he has introduced the first carbon oxide laser into the laryngeal surgery, and it has spread, and a lot of literature, a lot of scientific work was devoted to develop this technique. Here in Szeged as well, I have listed them. And why it is so important? What are the advantages of laser surgery? Much less bleeding, the much quicker recovery of the patient. It is much more cheaper because the patient needs not so many medication and much less consequences and side effects of the surgery, less postoperative pain, because it is the majority of them are not contact, so there is no device which will make an inflammation, so it is much more sterile than the conventional surgery. there are possible wavelength-specific reactions, coagulation, for example. Microsurgery can be done under a microscope, and the laser beam passes through the same microscope, so it is really cell-based surgery. There is a possibility to perform surgical procedures without opening the body, luminal organs, or wherever an endoscope can be inserted. And it is a very precise cutting tool, and it can be controlled computer, can be enlarged, the image can be enlarged, so there are lots of advantages, and again, the spread is not so quick as it should be. And the cause of it, that some institutions, some clinics has both the first generation lasers, and they have not always the best experiences, and they did not change it for newer and newer generation. However, there are large development from that point of view, from the first same dioxide lasers, carbon dioxide lasers to neodymium and diode tone lasers. And I would like to show you the actual procedures of the prostate surgery with lasers, which are already used here in Szeged, the holmium YAG laser and the holmium diode laser combination, but they would like to get a thulium laser, which is considered better. And we have to know that there are lasers which are mainly used for coagulative procedures, for cutting, and in that case the sharp edge is very important, and for vaporization. For example, if there is an enlarged prostate and it occurs after 70, 80 ages for almost all of the men, it caused difficulty of emptying the urinary bladder, because it caused an occlusion of the urethra going through the prostate. So here is the bladder, and the urinary process is go through urethra, which is go through in the middle of the prostate. And if the prostate is larger, then the lumen will be smaller, and the man has difficulty to urinate. And the method is to enlarge, to get rid of tissue, prostate tissue around the urethra. And the possibilities to evaporate this, or to cut, or, which is even better, to encapsulate completely, to remove the prostate, especially if there is a suspicion of having prostate cancer, because the hyperplasia can be a basis for cancer development. And it is easy to detect or easy to have a suspicious status on cancer, because there is a good marker, a serum marker, the PSA, the prostate-specific antigen, which is detected, and if it is true, then biopsy can be taken from the prostate and can confirm the tumor existence. And nowadays, the MRI and other volumetric imaging can show us exactly the place of the tumor. So there are the comparison of different lasers, the lithium tiborate laser, which has the wavelength of 532 nanometer and 120 watt. Fast vaporization can be achieved and can be used really for very enlarged prostates. The holmium YAG laser has a 2140 nanometer wavelength, and it is absorbed in 0.4 millimeter and coagulate the vessels at 2 millimeter depth. The different methods which are used, the laser ablation of the prostate, which can be done with holmium or thulium laser, and the laser resection of the prostate. In that case, the prostate, the larger pieces of the prostate is collected in the bladder and made it little pieces in the bladder and emptied via cystoscopy. So it is not an open operation. Everything is done via an endoscope, a cystoscope. And if it is done during some hours, the patient may be anesthetized and can leave the hospital on the next day or even immediately. And this is through as well as to the holmium-thulium laser enucleation of the prostate, which is a complete prostatectomy. It is corresponding to the traditional open prostatectomy. It is very important, open prostatectomy, and not transurethral prostatectomy, because actually there is an existing method of transurethral prostatectomy, but this is not ablative from the point of view of oncological removal. So if we would like to get rid of the prostate, which contains tumor, we have to perform an open prostatectomy, actually, with a lot of side effects, a lot of problems, sexual problem, urinary emptying, urination problem, and so on. And with this easy method, it can be everything spared, the function maintained, and a complete prostatectomy performed. The diode laser, I don't go in huge details because we have a lot of other topics, but I would like to tell you that there are emerging techniques with twisted laser fibers and with MRI image guidance, which allow laser needle insertion into exactly the tumors and the gallium S. And there are further developments, further emerging techniques, the resopulse hormone laser, the Lamelis thulium laser, multiplies combination of thulium with diode laser and Origin XL. And we arrive to a topic which is highly discussed. Is there any sense to use low-level laser therapy at all? Has it any effect? But nowadays there are growing evidence that really the restoration of cell membranes led to significant improving of tissue regeneration, healing tendency can be improved, especially in hypoxic areas. The large ulcers can be treated with this method, and additionally it has a sterilization effect and improvement of the blood circulation, all add together, decreasing the inflammation process, and we don't believe it if it is not proven. So there were a publication in 2001 presented at the ASCO meeting in Chicago with laser therapy of patients who were undergone chemoradiotherapy for head and neck cancer, and we know that these patients are suffering awfully because of mucositis. And this mucositis could be treated. It was the hypothesis, and 47 patients had been included into the study. Everybody has received chemoradiotherapy in a standard manner. Cisplatin was additionally administered each third week, and the placebo arm has received as well as some light therapy, but not really laser was switched on, and it turned out that this was the laser parameter which was used for joule per quadrat centimeter, energy density 60 nanometer wavelength, and the control group received the same procedure without real treatment, and it turned out that the seriousity of the mucositis could be really reduced with the laser technique. This is the green, in comparison of the placebo arm and it was highly significant difference between the two groups. However, this patient population was only 47, but they could conclude that it is it may be a useful method to decrease the mucositis which caused by the chemoradiation, and it was repeated 1 year later with larger patient number, with 111, 110 in the two arms by another group from India. The first group was Brazilian, and they could as well as conclude that it has a significant difference. It could result in a significant difference for lasers.